Thank you for tuning in. My name is Amy Johnston. I am a PhD candidate in the School of Epidemiology and Public Health at the University of Ottawa and a trainee at the University of Ottawa Heart Institute. I'm delighted to be hosting today's special episode of BEaTS Research Radio, a YouTube channel and podcast that aims to disseminate science within the broader community. This episode is a special spotlight for the 2021 Canadian Women's Heart Health Summit, and today I have the honor of speaking with Dr. Coutinho. So in addition to being the co-chair of this year's virtual summit, Dr. Coutinho is the chief of the Division of Prevention and Rehabilitation and the chair of the Canadian Women's Heart Health Centre at the University of Ottawa Heart Institute. She's also an associate professor of medicine and at the University of Ottawa, a clinician scientist and a practicing cardiologist. Welcome, Dr. Coutinho.
Thank you, Amy, and thanks to the BEaTS podcast team for this opportunity.
So thank you for being here. I want to get started by asking you if you wouldn't mind talking a little bit about the history of the summit. So when it began and, what was the intention behind it? And also tell us a little bit about this year's summit.
For sure. So I always say that I'm so lucky that I kind of joined the summit boat right as it was departing. And taking the float. So what happened was in 2016, that's when the first summit was held, but that actually was a few years in the making. So when the University of Ottawa Heart Institute fundraised to develop the Canadian Women's Heart Health Centre, there was a lot of consultation that happened with stakeholders, patients, providers to design what was going to be the priority of the Canadian Women's Heart Health Centre. And one of the priorities that was envisioned at that time was an educational summit that was going to help bridge knowledge and practice gaps about women's heart health in Canada. So the vision for the summit preceded me, actually. It was the vision of my colleagues at the University of Ottawa Heart Institute as they developed the Canadian Women's Heart Health Centre. And then as I joined the Heart Institute in 2013, and of course had an interest in this area, they invited me to co-chair the summit that was going to be taking place in 2016. The funny part of the story is that I co-chair that entire meeting. I planned every single little piece of it with our team and also with Heart and Stroke. And then I had a baby just 10 days before it, so I couldn't attend it. And so people tell me the first summit was great, but I wasn't there for it because I had a 10-day-old colicky baby. But that's how it came to be. So the first one was launched in 2016 with this objective of truly focusing on the important needs and the unique aspects of cardiovascular health and disease in women, which are things that we don't usually talk about very much in a day-to-day. 2016 was a great success. Then we decided to continue hosting it every second year. So we had a second summit in 2018. Both of them were here in Ottawa. The second summit, we changed things a bit. We created a theme for it. And the theme at that time was cardiovascular health across a woman's lifespan. So we started off with young women and then finish off with issues that affect older women and anything in between. So it was really great. This one, I did have the opportunity to attend in full. So it was really great. This year was supposed to happen last year. It was supposed to be in April of 2020 here in Ottawa again, but the pandemic, of course, prevented us from doing so. So we decided to change. And when you ask what is different about this year, first of all, it is fully virtual. And this is not something that we have ever done before. This is totally new to all of us. But we felt there was still a strong need to continue educating, to continue advocating and networking this community. So we really wanted to keep the summit here and make it virtual. And actually, even though it has been a challenge to adapt to this new reality, it has been incredible because just if you look at the number of registrants, it has more than doubled from our usual. We usually have, the first summit had a little less than 180, the second summit had a little over 200, and this year we're just about hitting 500 delegates for this summit. So we are taking this opportunity to really help deliver this to more people throughout this country and beyond. So that's first the main difference about the summit. I think another different aspect of the summit this year is that we took a lot more consultative work with our patient partners and women with lived experience. It's always a pleasure to work with them because I always learn things differently. I see things through a different lens. And we have actually had a lot of incredible input from our patient partners who have lived experience in heart disease, and this is something that it's a lot more engaged this year as it's been in previous years as well. So it's all this to say, we are very proud. We can wait to see what the summit's going to bring, and to see the amount of networking and knowledge that's going to be able to spread this year.
Wow, that's it's really exciting, and it's great to see that the number of attendees is going to be up so much this year. I guess it's easier to justify, when you can pay to log in on a computer as opposed to having to actually fly somewhere. So I guess that's an advantage of a virtual summit.
Yeah, and also we know we're learning this year so many things that we're going to be doing forever, right? And I think this is going to be here to stay. I can totally see how in future summits we hopefully will be able to host it again in person. But this online presence is so strong that I think we're going to be able to blend both in future summits and be able to offer both in person and virtual for anybody who wishes to attend, has the opportunity to do so.
Yeah, that's great. So I guess we'll see what the future brings.
Mhm.
So just building on that, I wonder if you can talk a little bit about why it's important to have a full conference that's dedicated, to women's cardiovascular health.
Yes, that's a great question, Amy. I think a couple of things that we have to remember. First of all, cardiovascular diseases are the number one killers of women in the world. So we do have to pay a lot of attention to it in general. So that's one aspect of it. The second aspect of it is there is no formal pathway for healthcare providers or research trainees as part of their training or even as part of their practice. There's no formal pathway for us to learn about the unique aspects of cardiovascular health in women. I can say now, as a cardiologist, I had 6 years of medical school back in Brazil, 8 years of residency and fellowship training in the United States. And there was never a dedicated piece of my lectures or my experience that was focused on this very important aspects, which are very different in many ways for cardiovascular health in women. So everything I have learned through going to go get this knowledge, right? So when I was at the Mayo Clinic, I went and did electives at the Women's Heart Clinic with Dr. Sharon Hayes at the time and Dr. Sharon Mulvey and others. And that sparked my interest. But that was, it was an elective time that I went to spend with them. And since then, there has been really no other formal path. And I think many people find themselves in this situation. So if you don't have the opportunity to learn about it, you're less likely to be able to apply state-of-the-art knowledge to the care of our patients. So we think that having a focused summit that every second year brings updated science, clinical practice changes, networking capabilities, because that itself is actually very important. I always say that for my women heart health clinic patients, many of them have spontaneous coronary artery dissection, for example. What I do for these patients is not necessarily something that I've read in the book. It's because I've learned from the patients, I've networked with other experts. So all of these opportunities are enhanced in the form of a formal conference. And third, I think the other aspect that we have to consider that is so important for this summit to exist as a separate piece from other conferences is just the science, right? If you just look at science for women's cardiovascular health in general, two-thirds of, or even three-quarters perhaps, of all cardiovascular science to date has focused on men. So by actually putting the spotlight on sex and gender-based science, stimulating others to engage, and highlighting what's out there, it's very important. So we're very, very proud of the summit. We think it's a pivotal piece in terms of, educating, advocating, and networking. And we hope that it continues to grow in the future iterations.
Great. Well, clearly all excellent reasons to hold an event like this. So thank you, Dr. Coutinho, for being here and sharing information about the summit and your expertise. And I personally, and I know so many other people, are really looking forward to this year's event. Unfortunately, this is all the time that we have for today. So I'm going to conclude this very short episode of BEaTS Research Radio. I'd ask you to please subscribe to our YouTube channel or find us on your favorite podcast app. And on behalf of the whole team at BEaTS Research Radio, stay safe and heart healthy.